From allergies in the spring to wildfire smoke in the summer to the winter blues, the changing of the seasons can impact our bodies in different ways. I'm Christine Pae for King 5's Healthlink. Each week I report on a health or medical topic impacting the community. Today we're sharing a couple of those stories. Here's what you need to know about seasonal issues common in the Pacific Northwest.
The season hits you a little bit sooner. It's hard, right? You're not really on top of it.
Dr. Stacy Pae is an allergist and an assistant professor at UW's Division of Allergy and Infectious Diseases. She herself endures hay fever every year.
I think a lot of allergists go into the field because they've suffered with it throughout their lives, and that makes helping patients a lot more enjoyable.
Symptoms include itchy and watery eyes, a stuffy nose, and sneezing. How can you differentiate allergy symptoms from, let's say, cold symptoms?
I would really go off of the whole constellation of the symptoms. If somebody's having a fever, that would not be expected for an allergy. But in the beginning phases, it can be really tough.
Treatments range from oral antihistamines to nasal sprays, and if those don't work, immunotherapy with allergy shots. Dr. Ma's other advice, asking your doctor about treatments ahead of pollen counts going up. This graph from the Northwest Asthma Center shows we're currently at peak maple and cedar pollen levels. Come May and June, grass pollen ramps up.
I think a lot of what we do is telling people to start ahead of the season, start your medications 2 to 4 weeks before the season starts.
Allergy symptoms are also showing up earlier.
I think I'm just noticing how many more of my patients are coming in saying they're having bothersome symptoms sooner that they just couldn't get a hold of.
Dr. Ma points to the changing climate as contributing factors.
Higher temperatures and higher CO2 levels, those can stimulate photosynthesis, plant growth, pollen production. So as we're really seeing temperatures rising and seeing in the environment, kind of more byproducts of things, I think those two seem to come along quite clearly.
Other ways to lessen allergy symptoms is immediately changing clothes after you've been outside for a while, also showering before bed to remove any pollen from your body or your hair, and saline nasal rinses can also help.
People don't realize that getting into very cold water like we have here in the Northwest, it can kill you within a minute.
Dr. Stephen Morris is an ER doctor at UW Medicine based at Montlake and Harborview.
This time of year in particular, we see people that are going into the water thinking they just want to swim and cool off and have a nice time, and then end up in a really terrifying and life-threatening situation.
While there's a recent trend of people taking cold plunges with claims it helps with exercise-related muscle damage and boosts your immune system, Dr. Morris doesn't recommend it for everyone.
I think if you're doing a polar bear plunge and you have one of your friends on each side of you, it's a little bit safer. I think it's very, very different from somebody jumping into a cold lake and not knowing what they're getting into.
Whether it's voluntary swimming or an accidental fall into the water, cold water shock can result from being in water 50 degrees or colder, how it is right now from all that mountain snow runoff.
Just to paraphrase one of the writers from the American Heart Association, you're not a polar bear.
For humans, the shock can cause involuntary gasps for air, hyperventilation, even cardiac arrest and other heart problems.
It increases your heart rate drastically. It increases your blood pressure drastically. And if you have an underlying health problem, that can be enough to cause a stroke, to cause a heart attack. It's caused heart attacks actually in very young people.
And finally, panic can set in.
So you have an altered mental status. So you're in this dangerous, life-threatening situation, and then all of a sudden you're making poor decisions or you're not able to comprehend what's going on.
Morris adds if you happen to safely pull someone out of the water who's experiencing cold shock, warm them up gently right away.
Skin-to-skin contact is a really safe way to rewarm someone.
And call 911 immediately, as they may still need medical attention. His biggest advice, don't take a dip for now.
Enjoy the nice weather and do other activities, but I would avoid swimming in any of the cold water that we have right now.
Everything you'll see in the literature is calling for more research into this.
Dr. John Mignone is a cardiologist at Swedish Health, specializing in heart failure treatment. He knows the impacts when wildfire smoke clogs our skies.
We definitely do see higher levels of heart attack at that time.
Unhealthy air doesn't only affect the lungs, it can be dangerous for the cardiovascular system. For people with existing pulmonary disease, it can even lead to heart failure and stroke.
You have both chemical and fine matter particles that get all the way down into the deepest areas of our lungs, and they could sit there and cause oxidative stress.
Those are some of the short-term impacts, but could a persistent seasonal onset of wildfire smoke in our atmosphere affect us in the long run?
We don't have a complete picture of exactly how wildfire smoke will impact our health, but we are seeing a lot more evidence that's suggesting that people who consider themselves to be young and healthy may actually be at higher risk than they previously were perceived to be.
Addison Houston is a climate adaptation strategist for Public Health Seattle and King County and says more research is needed. The focus, he says, should be understanding those really small particles in wildfire smoke that measure smaller than PM 2.5.
Which is very fine particulate matter that has a diameter about 20 times narrower than the width of a human hair.
Wildfire smoke particles can include chemicals, carbon monoxide, nitrogen oxide, and other volatile organic compounds.
All these things can cause free radical damage to the DNA. So this is at least what we know about smoking.
Dr. Mignone says that could lead to worsened lung function, but more research needs to look at which particles from smoke could lead to those long-term impacts.
If there's a particular particulate matter that we could determine is the biggest offender, that's something, but there are very sparse amounts of data about that.
The Public Health Department says to avoid spending prolonged time outside when the air quality is bad. And if you must go outdoors, an N95 or KN95 mask will help. It's also recommended to install a MERV filter indoors to filter out any harmful particles.
So there are tendencies that people notice that they might feel more fatigued, more worn down, a little bit more lethargic in the winter months due to the lower levels of daylight.
Less sun means less serotonin production, which can lead to feelings of depression, irritability, and a lack of energy. Conversely, this could lead to more melatonin production, which increases sleepiness, so you might feel the need to sleep in during winter months. But there are some remedies to consider. Darcy Newby, a licensed therapist at the Overlake Specialty School, advises going outside for at least 15 minutes a day, rain or shine. Sunlight is key here because there's less of it right now. Our bodies produce less vitamin D, which promotes serotonin production.
I do know in this region, it's really critical to make sure you're having adequate levels of vitamin D, and even to increase that during the darker, longer winter months. That's really key.
Newbie adds exposure to a bright light, also known as SAD lamps, can help boost serotonin levels. Research shows exposure to a light at 10,000 lux for half an hour, 7 days a week can improve SAD symptoms. An important step in all of this is recognizing those symptoms. If your feelings of depression and anxiety do not go away despite some of these remedies, Newbie advises talking to your doctor. Thanks for joining us today. To check out my most recent Healthlink report and get the latest health news, visit king5.com/healthlink.